Zealand has been at alert level 3 for a week now, and with more businesses operating, it's brought some relief to the economy. With the number of new cases of COVID-19 staying at single digits for several days and then 0 for the last 2 days, there's been questions over whether the move to level 3 could have been made sooner. Could New Zealand have eased restrictions and been more like Australia, which has also managed to significantly flatten its curve in the same time? Indira Stewart has this report.
Sepali's floral studio in Auckland's Mangere Bridge has been busier than ever this past week.
People were asking me for flowers when we were in level 4. And, of course we couldn't do that. But, so I was expecting that. I was expecting a busy first week back.
Sepali says being a small operation at level 3 means the safety guidelines haven't been too difficult to put in place. And she says she could have operated just as safely during the lockdown. But even if she'd been allowed to, she doesn't think it would have been financially viable.
The problem is the supply of product and willingness of people to come and purchase from you. I think that would have been the problem. I wouldn't have had the same amount of sales to have the shop open, to take that risk. I don't think I would have been able to get couriers to deliver. So I actually don't think we could have done it at level 4.
Both Australia and New Zealand have managed to flatten their curves in almost the same amount of time. Yesterday, Australia marked 100 days since its first confirmed case of coronavirus, with just 27 new cases across the country. While today, New Zealand announced no new cases for its second day in a row. But Australia's restrictions haven't been as tight as New Zealand's, prompting questions as to whether our government could have eased restrictions sooner, lessening the forecasted impact on the economy. While some have looked across the ditch with envy, Dr. Alan Cheng, who is the Professor of Infectious Diseases Epidemiology at Victoria's Monash University, argues things aren't as different between the two countries as people think.
Look, I think it's actually been a lot more similar than people say. I think New Zealand probably locked down slightly earlier and slightly harder than we have, but I think, Australia and New Zealand have probably taken a fairly similar approach.
So how similar have the approaches been over the past 6 weeks? The rules across Australia's territories and states are fairly similar, with some minor differences. Generally, people could still go to work if they weren't able to do so from home. They could still get haircuts, and they could also use babysitting services if they needed to. Retail shops have been allowed to stay open with a 4 square metre rule. That means no more than one person for every 4 square metres of available floor space is allowed inside a shop. Queensland and the Northern Territory have opened playgrounds to the public for the first time in weeks. In Queensland, you could have up to 2 visitors in your own home. In New South Wales, you could meet up with one friend at a public place, but you must stay 1.5 metres away from each other. Bars and restaurants have been allowed to stay open to provide takeaway services, and the country's mining and construction industries have continued to operate. Dr. Cheng says while allowing more businesses to stay open sounds good in theory, in practice, the reality has been markedly different.
There's never been a sort of an absolute dictum that you can't open a shop, but that, you can only sort of allow a certain number of people into a shop, and then that just makes it not financially viable. A lot of businesses have pretty thin margins, so any restriction would make it very difficult for them. But in terms of the exact sort of what it actually translates to on the ground is often a little bit different to what the policy is.
Wellington-based economist Elizabeth Kendall has spent many years forecasting and modelling at the Reserve Bank in Australia and New Zealand, and she's been watching consumer reaction closely across both countries.
Even though Australia's lockdown has not been so strict, the behavioural response of people in the face of this outbreak is that they have really responded by staying home and not spending. And so activity has been reduced in places even where it was permitted. And so we've actually seen a reduction in activity in Australia that is more similar to New Zealand than you might expect.
Ms Kendall says she believes New Zealand made the right call going into a strict lockdown, and for a very different reason. Dr. Brian Cox, an epidemiologist at Otago University, agrees. He says without the lockdown, New Zealand wasn't prepared for an outbreak.
Australia was very good at contact tracing. We weren't. We had planning for a flu pandemic, but this isn't flu. This doesn't This is a cluster-based epidemic, which is a completely different beast, and you have to have a different way of tackling it. And that involves early diagnosis, contact tracing, contact them quickly and isolating them. We didn't have any plan for that approach at all. And we had to go into a lockdown to cope with the fact that our contact tracing wasn't as good as it should be.
Ms Kendall says the trade-off of being more cautious, going hard and going early was worth it.
Overseas, we've seen that the consequences of going too slow and being too loose in restrictions has sort of devastating consequences. You know, I think we made the right call. Maybe at the margin we could have been a little bit looser in our restrictions, but ultimately we've saved a whole lot of lives, and I think that's a great success.
For Checkpoint, Indira Stewart.